And good afternoon. It is Friday, and that means it's time for our Lunch and Learn. Now, today we're going to talk about migraines because migraines affect quite a few women that we know, and we have people that come into us and they have migraines. Sometimes it is hormone related, but sometimes it is not. And so we've got different things that we try here in the clinic, but I found this article, and I thought the article would be really good to go over with you because it is really, really simple to get these migraines under control. I used to suffer migraines myself when I was younger, when I was in my 20s, and now I have not had a migraine in like years and years and years and years, and so I'm very grateful to God for that because they're so debilitating. And migraines are, 1 in 6 of us suffer from them, and so you can have the kind of migraine that is just a pounding in your head. You can have the kind that comes with nausea. You can have the kind that come with the ocular issues. You can't look at bright lights. You need to be in a dark room. And those are the kind that my mother used to have. I don't remember having that. I remember the nausea and just the extreme headache. So we're going to talk about this today because this report comes from a nutritionist who suffered from migraines for about a decade, and she did all kinds of diet augmentation, she did prescriptions, she did all kinds of things, and she read on a social media group, I didn't say which one that she read it, but she read in a social media group that if you just used some salt, sprinkle some salt in some warm water, that it would alleviate migraines. And so that's what she did. And she said that within 30 minutes, the headache was quite a bit easier and that the salt remedy worked much better than any other thing that she had ever tried. And so this is something that we want to talk about because everybody has salt in their cabinet. And so it was funny yesterday as a teaser, I did the sneak peek as I always do on Facebook, and I asked, what do you have in your kitchen cabinet that's good for migraines? Never, ever believing that people would respond the way they did. One lady said that she's got a cast iron skillet. One gentleman said that he had a bottle of Crown Royal, and only one person said that they had Celtic salt. So Celtic salt or sea salt is what you want. You don't want your regular table salt. Your regular table salt will not work. Now, why is that? Because your body is suffering from dehydration, and table salt is a dehydrator. So you're going to want to get Himalayan salt or Celtic salt, or my absolute favorite is the Selena sea salt. Now, I like Selena sea salt because it has all 12 of the tissue salts. So a lot of times when people are thinking about sea salt, they'll say, well, we don't want sea salt because it has all the contaminants that were in the sea and all that kind of stuff. And I'm just here to tell you that the only thing that we use in our home is Selena sea salt. And so we do that because those are the minerals, they're micro minerals that help your body do what your body needs. So there are 12 of them. Sometimes people say 13, and I have a list. There is calcium fluoride, calcium phosphate, calcium sulfate, iron phosphate, potassium chloride, potassium phosphate, potassium sulfate, magnesium phosphate, sodium chloride, sodium phosphate, sodium sulfate, and silicon dioxide, right? So those are the 12 tissue salts. Sometimes you can get them in a bundle, and they have all of them, and that's what you need. So it is this kind of salt that your body is needing, and this is what you're wanting to do to get rid of your migraines. Now, historical data has often associated salt with various health problems, such as cardiovascular issues and all that. Now, we know we're not supposed to have high usage of table salt because high usage of table salt, what does it do? It makes us retain water. It makes us thirsty. That's because that's not a natural tissue salt that we need. Yes, it makes our food taste good, and yes, I will say that I do salt my food, but we use Selena sea salt. So there is research that was done in the British Medical Journal in 2014 that linked high sodium diets with headache risk. A 2020 study highlighted women who strictly adhered to the low-salt DASH diet saw up to a 46% drop in severe migraines. Yet, so that was in 2020, yet a growing contingent of health experts are offering a divergent view. Recent research suggests that dietary shifts, noticeably an increase in salt intake, might be the key to migraine management. Now, again, we're not talking about table salt. We're talking about the good kind of salt, all right? So the women that did the DASH diet, they reduced their table salt, and they found that they are not having as many severe migraines as they had before. So there's a huge difference between the detrimental effects of table salt and the beneficial effects of Himalayan salt, pink sea salt, or my favorite, Selena sea salt, all right? So migraines are more than just amplified headaches, multifaceted neurological disease. Now that makes it sound really, really terrible. Anytime you put the word neurological in front of anything else, we know that we've got a problem, okay? According to the World Health Organization, migraines rank among the top 10 most debilitating medical conditions. The condition is so common, all right, that there's a name for migraine sufferers called migraineurs, all right? So you think of entrepreneurs, right? Migraineurs. So I don't want to be in that category, and I know you don't want to be in that category either. So migraines are typically marked by severe head pain, often manifesting in other ways: light sensitivity, nausea, brain fog, and dizziness. These are triggered, right, from dietary sources, all right, fear and anxiety, but nobody really knows for sure what the problem is or why people have migraines. Now, a lot of my women, as I said before, they think that their migraines are associated with their hormones. There's really no research to substantiate that. There may be something with their water consumption, something with their salt consumption around their cycles that causes the migraines to be there, but I don't know exactly what the answer is to that, and nobody else does either. So the challenge does not end with a migraine with their physical symptoms. Chronic migraine sufferers, which number up to 148 million people globally, grapple with this unpredictable condition. You never know when you're going to wake up and have a migraine, or when you're going to wake up and you're going to be just fine. This affects daily life. Now, we do have a little device that we have here in the clinic, and it's called a Heil-Mealey, and you spell that Healy. And you put some little clips on your ears, and it's a little device. I didn't think to bring it with me today. It's always in my office, but it's not here where I am with you. Anyway, you set it to a migraine setting, and you clip these little clips on the lobe of the ear, and within 20 minutes, the migraines are gone. So this is a device that anybody can have, anybody can purchase. So if this is something that you need because you are a frequent flyer in the migraine area, then that's something that we can help with too. But salt, sea salt, is in your cabinet, or should be in your cabinet, and it is a winner as well. So the battle against migraines is a trial and error one. What works for one person may not work for another person. We had people that responded to the Facebook tease that they had used peppermint essential oil. Well, peppermint essential oil does work because it is a vasodilator. And so if you put it in your temple, don't get it too close to your eye, put it in your temple, put it on the nape of your neck, then what that does is all the little capillaries, all the little blood vessels, they just expand and become more flexible. So if your headache is caused from tension, if it is caused from anxiety, that's going to open that up. That's going to allow that blood to flow more easily. And so that does work for some people. We have definitely tried that with people, and it does work. So there are drugs that your doctor can prescribe, all right? There's acupuncture, chiropractic sessions, all of those kind of things. However, even with all of those kind of things, migraines cost $20 billion annually, according to a study in 2020 in the American Journal of Managed Care. That's a lot of dollars that we spend trying to manage migraines. So if this is you, If you suffer migraines, you really want to pay attention here because sea salt is going to be your friend. Sea salt is really, really cheap, not expensive at all. Salts linked to headaches is well documented, but a study published in the Mental Health and Family Medicine suggests that there may be nuances to that connection, and the answer to treating migraines may hinge on diet. So Angela Stanton, who is a migraine and nutrition scientist, spearheaded a 6-month study involving 650 migraineurs on a special Facebook research group. The results were striking. Migraine frequency seemed to be heightened by diets that were high in carbohydrates and low in salt and water. Medications that block voltage-dependent calcium or sodium channels appeared to aggravate those conditions. So we're talking about calcium blockers, beta blockers, all those kind of things. So those are heart medications. So if you're taking one of those, this could be why your migraines are more pronounced, all right? So in this Facebook group, 650 participants, right? They decreased their carbohydrates, they decreased their sugar, they increased their salt, and they found that they could prevent the glucose-induced electrolyte changes that often lead to migraines. Impressively, every single participant who adopted these dietary changes were able to stop using migraine medications and remained free from migraines. Now, they don't tell us how long they remained free from migraines, but over this period of a study, which I think it was 6 months, that she did that, they remained migraine free. So a lot of it is your diet. So we do not say increase your table salt. We're not saying that. But what we are saying is make sure that you decrease your carbohydrates, increase your water, and make sure that you're doing the sea salt, because the sea salt facilitates the I want to say electromagnetic, but that's not really the right word, but the voltage in the cells. So you've seen this before. If you haven't seen this, you can Google it. What is the cell voltage of a healthy cell? And usually what you will get is an infographic, and it shows a healthy cell at this frequency, and then as the numbers go down and the numbers go up, you'll see what happens to the cell. So anytime our body is not functioning the way it needs to function, it is because we have a frequency problem. When we are healthy, when all of our frequencies are working the way they are supposed to, we've got great immunity, we've got great antioxidants, we've got all the things that we need so that we can live a long and healthy life. When our cells do not have the voltage that they need, then we have problems. So what causes cell voltage? Water and salt, or minerals. All right. Most of the time in America, when we hear salt, we only think of table salt. But I just read you a list of all of these tissue salts, and the tissue salts are what make our body work the way they need to. So calcium fluoride is for weak tissue, weak muscles, varicose veins, and dental problems. Calcium phosphate is for growth of healthy bones and your healthy heart. Calcium sulfate is for colds, flus, also skin disorders. So these are salts that your body needs. They absolutely need. And if we don't have them, we are not going to have the voltage that we need in order to stay healthy. Iron phosphate is for inflammation, fever, anemia, and fatigue. Potassium chloride is for ear infections, colds, flus, sinuses. So if you have chronic sinus issues, you may have a loss or the word is coming to me, detriment, and that's not what I need. Deficiency is what I need. You may have a deficiency of this tissue salt, which is causing your sinuses to be all jacked up. All right. Potassium phosphate is for nervous exhaustion, stress, anxiety. So we want to have that in buckets, right? We want to have that. If you have potassium sulfate, it's for skin problems, dandruff, all that kind of thing. Magnesium phosphate is for muscle cramps. spasms, menstrual cramps, and digestive problems. So if you feel like you are suffering from migraines because of your menstrual cycle, then this is a particular salt that you want, magnesium phosphate, all right? Sodium chloride is for water balance, to make sure that you are hydrated, make sure that you don't get allergies, colds, cold sores, or it even helps with the emotion of grief. So these are tissue salts, not table salt, but they're all combined in a really good sea salt. And so that's what you're wanting. If you have acid reflux, and a lot of people do, you want to have sodium phosphate, that's for acid reflux, indigestion, heartburn, and joint pain. So and this is something that we see every day, joint pain, acid reflux, how many prescriptions are going on for that, right? Liver and gallbladder problems, you're missing sodium sulfate, and then acne, boils, skin problems, nail problems, all of that is silicone dioxide. So all of these 12 salts, you can see what they do in the body. If you are deficient in that, if you are deficient in your water, then that is what could be causing you to have migraines. The lady, Miss Teasdale, who watched this video in the social media group, decided to do the salt and the water. This is her exact quote. I was taken aback when the pain started to dissipate. An hour later, it had completely vanished. Despite my initial skepticism, given my past failed remedies, this felt different. Eagerly, I awaited my next migraine. Now, I mean, that just sounds a little bizarre. Eagerly, I awaited my next migraine to test the remedy once more, and yet again, it worked flawlessly. Mrs. Stanton, who is the one, she's the nutritionist who deals with the migraine people, she looked at 650 people. She said with more than 15,000 members on her private Facebook page, every one of them has had significant reduction in migraines. So if you are a migraine sufferer, you might want to find Mrs. Stanton, Stanton. You might want to join her page if she will let you. It's a private page, so I don't know what that takes. And she gives out protocols on how to change your diet to a low-carb diet and how to administer the salt in the water and all that kind of thing. So she gives specific hydration guidelines. Now, we give guidelines as well, and what we say is that you want to make sure that you are drinking half your body weight in ounces. And so if you are a migraine sufferer, what you want to do is take a pinch, not a whole lot, not a teaspoon, not a tablespoon, not a whole lot, just a pinch of sea salt, put it in some warm water, just a small amount of warm water, and drink it. And what that's going to do, that's going to change your electrolyte balance in your body. It's going to open up your blood vessels, and it's going to give you that relief that you want. In the study that she did for the 6 months with the 650 participants, she found that migraine sufferers excreted 50% more sodium in their urine than people who did not have migraines. So that's important. Migraine brain has a different brain anatomy with more connections among the sensory neurons. These sensory neurons are more active, they communicate more, and thus they use more sodium. So again, we're not talking about table salt. We're talking about tissue salts, because tissue salts change the frequency in your body. All of this boils down to salt's role in brain activity. The implications of this finding with the testing means that whether the increased sodium helps prevent migraines by simply consuming more salt is a good idea. I found that adding salt to water and not food helped tremendously, so you're going to have to drink it. Now again, just a few grains of salt. You don't need to have a whole lot. She elaborated, when glucose enters the cells, sodium efflux from the cells follow. So let me give you a little biology chemistry lesson, all right? So in our food groups, we've got protein, carbohydrates, fats, dairy. All right. So your carbohydrates are anything that is a plant. So your fruits and your vegetables are carbohydrates. Your worst carbohydrates are the ones that we manufacture, our bread and our pasta. Now, in the United States, because we spray our grains with glyphosate two times, then the seed is covered with glyphosate, which is a heavy metal, which attacks our body, and it makes us gluten intolerant. I don't think most people are gluten intolerant. If you have celiac disease, then yes, you are gluten intolerant. But if you're just a regular human being, you are glyphosate intolerant because glyphosate is a chemical and it causes cancer. So nobody wants that. Back to my lesson. When you eat carbohydrates, your body turns that carbohydrate into sugar, glucose, for fuel. Now, we need to have carbohydrates in order for us to function. We need to have carbohydrates in order to do what we need to do. However, when we have a lot of processed carbohydrates, bread, pasta, anything in a box or a package that's processed, we're going to have way more carbohydrates than we need. The body turns that into sugar, and sugar goes into the cells and it flushes out all of the sodium. So that's the mechanism that this lady is saying is the cause of the migraine. So people who do not eat high carbohydrates, and I'm one of those people, I do not eat a lot of carbohydrates. I very rarely eat bread. I very rarely eat pasta. I very rarely eat anything out of a box or a package. I eat my vegetables. I eat potatoes. Now, potatoes are high on the glycemic index. However, it is a food that is in its raw form that we're supposed to be eating, okay? So I choose, occasionally I will have a pasta. Occasionally I will have a bread, but generally as my regular diet, I don't do bread, I don't do pasta, I don't do anything out of a box or a package. Therefore, my diet is very low in carbohydrates. If you are a diabetic, which we have a lot of diabetics, I mean, that is one of the fastest growing diseases that we have here in the United States. If you are a diabetic, you want to make sure that you are having no more than 30 grams of carbohydrates per meal. That's no more than 90 grams of carbohydrates per day. And we have seen that when people have restricted their carbohydrates to that amount, that their glycemic numbers come down, their A1C comes down, and they're able to live without those medications and insulin and all that kind of thing. So this is one thing. I don't know why medical doctors are not telling their patients this, that they need to change over to a low carbohydrate diet plan, but they're not telling you. So I'm telling you, if you have migraines, you want to go on a low carbohydrate diet because that stops the influx of glucose into the cells and it keeps the sodium from being pushed out of the cells. Remember, the premise of this is that a migraine is caused by dehydration and not having the right tissue salts. So that is very, very important. She said her findings align with additional research on the topic. In 2016, a study published in the journal Headache, right? I don't read that journal. Thank you, Jesus. I don't have to read that. Delved into a similar inquiry using data from a 1999 to 2004 National Health and Nutrition Examination Survey. Analyzing data from 9,819 adults, the researchers discovered that those with a history of severe headaches or migraines consumed less dietary sodium. The data indicated that as sodium intake arose, the likelihood of migraines dropped. So this is a pretty big sample, okay? 8,000, more than 8,000, almost 9,000 people. That's a huge amount of people to study. As their intake of salt increased, then their incidence of migraines were decreased. So that's really, really important. That underscores the relationship between salt consumption and migraines. And again, if you joined us late, we're not talking about NaCl. That's not what we're talking about. We're not talking about table salt. We're talking about tissue salts. So as you increase sodium, and sodium is found in foods. You can Google a list of foods that contain sodium, and if you eat more of that, you're going to raise the correct amount of sodium in your diet so that you're going to be okay. Mrs. Stanton contended that while conventional wisdom warns against high salt intake, dramatically cutting salt could inadvertently trigger the body's, and I'm going to have to say this big long word, okay, renin-agostinin aldosterone system, which causes the blood volume to drop and blood pressure to rise. Conversely, she posited that increased salt intake may boost blood volume and potentially reduce blood pressure in individuals who have that problem. So what we want to do, right, we want to make sure that we have the right kind of salt. And what is the right kind of salt? You can put that in the comments. Make sure that you're listening. What kind of salt are we talking about? We are not talking about table salt. Don't blame salt. This is a quote from a doctor of pharmacy, Dr. James DiNicolantonio. Okay, that's a big long name. He says, don't blame salt for what the processed food diet, which is full of refined sugar, did. Now, and he's got a point. Processed food do have a lot of sugar and salt, table salt, okay? They have to give it so much salt to make it taste good, because it doesn't taste good, because it's processed. When they have all that sugar in there, sugar is more addictive than cocaine, so you can do the research on that. When they are processing this food, they add so much sugar, it becomes more addictive, and this is why people have a problem staying away from the fast food places, staying away from the boxes and the packages, because it just tastes so good. So the pharmacy guy, the doctor of pharmacy, says it is the refined sugars with the added table salt that has caused the problem with heart conditions. He emphasized that many studies demonstrate that improved insulin sensitivity, whether through a healthier diet or medication such as metformin, can nullify salt sensitivity. He suggests that the real culprit behind the salt and water retention and subsequent high blood pressure is poor metabolic health driven by diets high in refined carbs and sugars, coupled with a lack of exercise. So let me break that down for you, all right? So we need voltage for our body to work. We need water and we need tissue salts. When we don't have that, our bodies are not going to work. We're going to be tired. We're going to be lethargic. We're going to have insulin resistance. That's what this pharmacology guy says. Insulin resistant leads to what? Diabetes. We don't want to be insulin resistant. So the more we cut out high carbs and processed carbs from our diet, the better we're going to be with blood pressure, with insulin sensitivity, and with type 2 diabetes. And nobody wants that. Nobody has time for that. Nobody can afford that. Nobody needs to have that if we just modify our diet. And I get you. It is hard and expensive to eat healthy. Yes, it is. You go around the perimeter of the grocery store and you buy good stuff, you buy good meat, good vegetables, good fruits, and it is way more expensive than feeding your family fast food for the rest of the week. I get it. I've been there, done that. However, the cost of long-term health care is absolutely extravagant. So you're either going to make the choices while you can and choose to eat good food, or continue on the path that some of you may be on, and then you're going to have to pay big dollars going to the hospital, going to the doctor, taking all the medications and all of that. We had a lady came in just a few moments ago. She just turned 50, and when she came to see me, it's been about almost 3 months, not quite 3 months. She had a basket full of medications. She had not been done right by the hospital. She had not been done right by her doctors. And so we did what we do. And she says that right now, and she's still under doctor's care, she needs none of those medications. And so what did we do? We changed her diet. We made sure that her voltage was getting in the right frequency so that her body could heal itself, because that's how it works. Your body either heals itself or it doesn't. Medication will never heal you. What it may do, it may stop you from getting worse. It almost always helps you feel better because it turns off the symptom, but it very rarely ever gets to the core of the problem, which is where real healing comes from. Real healing comes from getting to the core of the problem, changing the problem, and then your body does what it needs to do. He says that sensitivities are often deficiencies in both potassium and magnesium. Now, when we think of salt, we don't think of magnesium and potassium, but as I just showed you on the list that I read to you, they are part of your tissue salts. And so this doctor of pharmacology is saying that correcting the deficits of these tissue salts can normalize blood pressure even if people do regular salt intake in their food. So I am going to stop with that report because I've gone slightly over my 30 minutes. Okay, I do appreciate you. I've given you enough information. You can go to any health food store and you can tell them that you want tissue salts. We all have them. We have them in liquid form. They don't taste bad. And what it does, it gives you every single thing that you need for your body to do what it needs to do. And so you want to do that, especially if you are a migraine sufferer. If you don't want to go to a health food store, but you've got good Celtic sea salt, good Selena, that's my brand, Selena Celtic sea salt. Why? Because it has all of the tissue salts in it. That's what I use on my food. If I had a migraine, I don't have migraines, but if I had a migraine, I would definitely put a few grains in some warm water and drink that, just like the report shows that in 650 people, they all did it. And guess what? 650 people did not have migraines anymore, as long as they stayed on that diet and they stayed on that regimen. So that's good news for you out there who suffer migraines. 1 in 6 of us do. So it is the weekend. Thank you for commenting. Thank you for liking. Thank you for sharing. Thank you for doing all the things. Thank you for honoring us with your presence here, because it would be pointless for me to do this if you were not watching. So I do appreciate all that you're doing, all that you're doing to help share and bring this information to other people that need it. And I will see you next week. It is the weekend. Take care of yourself. Be good to yourself. Do self-care. All right. That may mean going to the health food store and getting some tissue salts. That may mean going to the grocery store and getting some Selena Celtic sea salt, okay? Take care of yourself. I love you, and I will see you next Friday.